what I'm hoping is that this finding will hold up as we do more people and do this assay on more people to further provide evidence that this pathway is being normalized by the losartan. So Dr. Dietz mentioned the mouse model. So we're also working with that mouse model as well, looking at the immune system and the gastrointestinal tract of these mice. And so what I'd like to show you is that, so even if you've never looked at an esophagus in your life, you can take a look. This is a cross-section of an esophagus. So this little folded up portion in the middle here, that's where the food goes down. So it's all folded like that because it needs to expand to fit the food down through it. This is the muscle around that pushes the food down. And even if you've never seen an esophagus, that looks nice. It's just very nice and even, nice little clovers, nice thin. And this is the esophagus of a mouse who has the change in the protein that leads to Loeys-Dietz syndrome. And you can see that this looks very different from this. There are way too many black dots. Those black dots are inflammatory cells. So those are white blood cells that have come in. They've caused it to swell up. They've caused inflammation. And if you look at this under high power and you do a special stain that turns eosinophils red, you can see that these inflammatory cells are all, or mostly, eosinophils. So it appears that the mouse model of Loeys-Dietz syndrome, in addition to recapitulating all of the cardiovascular findings, also recapitulates the immune system and gastrointestinal findings. And so this is going to be a very nice model for us to investigate treatments and causes of food allergies and intestinal inflammation in people with Loeys-Dietz syndrome as well. So with that, I'll pause and we'll take any questions that people might have. Yes, sir.
I got a question. Now, back on the, are you talking about too much protein or the protein with the LDS? Is Pediasure, is that good for children with that have low or LDS?
So the question is Pediasure, and if Pediasure is a good addition to the diet with Loeys-Dietz syndrome. So in the absence of any food allergies, Pediasure is a fine thing. So Pediasure is a nutritional supplement. It's sort of like Ensure for kids. If there is no allergic disease, so then Pediasure is a fine supplement. Pediasure is a full protein, so the protein is not broken down at all. So if you are allergic to dairy, then it is not an appropriate formula, but if you are not allergic to dairy, then it certainly is a good way to get extra nutrition in.
Okay, thank you.
Yes, sir.
So is there any kind of wide groups of food we should look at for what might be causing reactions, or is it kind of specific to each individual?
It's very specific to each individual. One of the pieces of information that we get is from the blood tests that we do, but to be honest, the most important information we get is from the individual patient, because a history of how the child or the individual has reacted to each of those foods is very important in how we interpret the test. So it's very much based on an individual basis. We sort of know what foods are most commonly responsible for the disease, so we always know which ones are high on our radar to suspect. But again, it can be different for every single person.
I've got a question related to that. Say we're trying to tinker with trying to figure out what's causing these problems, our children's problems. Is there a time period, like, I don't know, let's say it's milk or something, you think cheese products. Is it a week, 2 weeks, a month? How long should you take something out of the diet to really be able to tell if it has an effect?
Right.
It's very complicated, all the stuff we eat every day.
It sure is. So a couple comments about that. The question was, how long do you have to take a food out of the diet before you know if that's somehow contributing to the problem that your child might be having? So again, as we mentioned, there's really two different types of allergies. There's the allergic type reaction where it's very immediate. You worry about anaphylaxis. That is where you're exposed to the food and you have an immediate reaction. So those, it's usually very clear what foods are provoking that. The more tricky one is where it's more gastrointestinal inflammation. And that's where you really need to take the food out of the diet for, usually you'll see some improvement by a week, but it can take up to 6 weeks for all of that inflammation, or even 8 weeks for all of that inflammation in your GI tract to actually go away.
And then you want to talk about label reading?
Right, that was the other point I wanted to bring up. So it's very tricky when you avoid a food, because say you're allergic to milk, and what we have to spend a lot of time educating parents is that doesn't mean they just can't have milk. They can't go drink, a glass of milk. Milk is in so many different products that you would never even suspect. It can be in pretzels, it can be in cookies, and it takes a very tiny amount. Certain medications may have something called lactose in it, and lactose is from milk. And so we have seen many kids now where they were just taking a pill that had just the tiniest bit of lactose in it, but because they were sensitive to milk, that tiny bit of lactose in the pill was enough to continue to cause this inflammation in their GI tract and cause symptoms, and it wasn't until we switched their medications that resolved. So it's very important to read all labels, not only for foods but medications, once we figure out exactly what foods someone is allergic to.
Maybe I missed this because I stepped out for a sec, but so you've recognized that seasonal allergies are more prevalent in the LDS children. Is there a different treatment strategy for the allergies with LDS children?
No, not the case. We generally treat them very similarly to how we would treat, the general population. The one exception is I mentioned with asthma. So a lot of kids with asthma, with Loeys-Dietz, we're finding that a lot of it's really driven by sinus disease. And once we clear that up, their asthma gets so much better. So that's the one thing. It's also true in kids that don't have Loeys-Dietz syndrome, but it seems to be even more common in kids with Loeys-Dietz syndrome. So we're very aggressive about treating sinus infections if they're also having severe asthma problems.
In the back there? Yes, ma'am?
Our daughter is almost 2, and she currently, knock on wood, does not have food allergies. Is this something you see they have from birth, or is it developed over time?
We see both. So most of the type of allergies where they get anaphylaxis, those types of allergies where you get very acute reactions, typically those develop very early on as a baby, and typically by the age of 2. The other sort of GI reactions, where it's inflammation in the GI tract, we sometimes don't see kids until they're teenagers or even adults. So that definitely can show up later on.
Yes, ma'am, in the pink shirt in the back?
Yes, that inflammation in the esophagus, can that cause Barrett's esophagus?
No. So eosinophilic esophagitis is not like the inflammation from acid reflux. So there's a question about whether eosinophilic esophagitis can lead to Barrett's esophagus. No. There are very different types of inflammation. Eosinophilic esophagitis can be painful. It can cause difficulty swallowing. It can cause poor growth, vomiting, diarrhea. But it does not appear to predispose people to development of any kind of cancer or pre-malignant precancer. Yes, ma'am.
You talked about the higher levels of eosinophils. Is there a change in the shape of the eosinophils as well?
They don't appear to function any different. So one slide I did not show that people with Loeys-Dietz syndrome appeared to have also more eosinophils just in general circulating in their blood, but they don't appear to act any differently. But we have not done any detailed studies on the function of the eosinophils themselves.
I'm talking about the physical shape of the eosinophils.
No, they don't seem to look any differently. Yes, ma'am.
I'm just curious, and I don't know if there's been study about this, but out of the approximately 200 people that have LDS, what percentage would you say has the gastrointestinal problems, or also allergy?
So 15%, 15?
So of the survey that we did, I think we have information on about 58 people with Loeys-Dietz. And when we did that, when we used a very stringent diagnosis of food allergy, which is probably a gross underestimation of what the true prevalence is in Loeys-Dietz, we found that 22% had definite food allergy. But the number is probably twice or even 3 times that when we use a more loose definition. And the reason is just, to truly diagnose a food allergy is difficult. It's sort of a combination of clinical history and blood work, and we just don't have that information on, everybody who answered our survey. So, but it's tremendously elevated over what you would see in the general population. With regard to EE, it was about 15% of people with a Loeys-Dietz syndrome. But again, that's probably also a gross underestimation, because the only way to diagnose EE is to get an endoscopy. So there's probably lots of people walking around with Loeys-Dietz who have, trouble swallowing, or have had reflux disease, or have had stomach issues, but have never had an endoscopy. And so we only consider those people as positive if they had that confirmative test. The other reason I think it's probably going to be higher than the 15% is because it's very prevalent in the mice. Almost every mouse we've looked at that has the Loeys-Dietz change or the Loeys-Dietz mutation has eosinophilic esophagitis.
Just one more question, Sam, on that. If, my daughter does not currently have any gastrointestinal problems, she may develop down the road.
It's something to always keep in mind. I have to say a lot of the people who have EE have had some sort of allergic issues earlier on, but that's not always the case. We certainly have had kids come into our clinic that never really seem to have much of anything going on. Or they've had poor weight gain, and that was really their only symptom, and was attributed to other, their heart condition, and they just never grew well, or for whatever reason it was just never recognized as being a food allergy or an intestinal problem, and was only recognized later on.
Yes, ma'am.
I have 2 questions. First of all, when you're doing the blood test for food allergies, do you just test the same foods for all people, and if so, what is it, a very long list, or is it just 5 to 6 things?
That's a good question. So her question was, what do we test for when we do blood testing for allergies? How do we know what to test for, and is it the same for everyone? The answer is that we know some foods that are very commonly associated that cause food allergy, but are also associated with this inflammation in the intestine. And we just know that from the years of experience of seeing, the benefit of having years of experience of seeing patients with EE, either with or without Loeys-Dietz syndrome, because the foods that cause it seem to be the same in both. So the list is generally pretty long, because it's, as he mentioned, you don't have symptoms right after you eat the food. It can be something, you could eat the food today and not have symptoms until 3 days later, when the inflammation in the intestines has really accumulated. So we may test for a very long list of foods, picking ones that we know are most commonly associated with the disease. Certainly we pay a lot of attention to what parents tell us. So if they tell us, every time Jack eats wheat and he gets stomach aches, then wheat is very high on our list as causing a problem. And some people will, they'll tell us the story, yeah, I started taking that out of my diet, and the stomach aches did seem to get better. They'll start, just from their own sense of themselves, can have some sense of what foods might be causing it. So it's a little bit of both. We sort of know what foods to go after, but then we also pay a lot of attention to what parents or patients tell us.
And my second question is, every time my daughter has her blood taken by our doctors, they always tell us she has a surprisingly large number of white blood cells. Is that because of her severe food allergies, or is that?
So some people with the severe food allergies, especially those with the eosinophilic esophagitis, not only have lots of eosinophils in their esophagus, but they also have it in their blood. And so sometimes those numbers can be very high in the blood. Not always, but sometimes. So it can be related.
We've got time for one more question.
Yes, ma'am.
For the testing, is it still like the pinpricks on the back for animals and stuff like that?
We tend to favor the blood tests. And so both the skin tests and the blood tests are looking for that flavor of antibody called IgE. The reason we prefer blood testing is because it actually gives us a number. And how high that number actually means something to us. It helps us figure out, now, is this really an allergy, or is this just sort of a false positive? So we tend to prefer the blood test for that reason.